And so now we're going to transition from traditional media to social media to the practitioner's perspective and role, and what are some things that we can be doing. And please join me in welcoming our third presenter, Dr. Robert Kim-Farley, who is professor in the departments of both epidemiology and community health sciences.
Thank you very much, and good morning. It's good to be here to celebrate our 60th anniversary together. So I'm going to talk and complement what's been said. It was mentioned by Dr. Garfin about the fact that conflicting messages can create, social stress in the individual. And I'm impressed that we are moving with the social media, especially in an era of not just misinformation, kind of benign, I didn't get it right, or disinformation where someone is trying to actually, sway you, to really almost an aggressive anti-science that we see today. That we as public health practitioners have to think about, how do we combat this? Some of the ideas have already been given, but I want to go ahead and talk about how I think that we need to do a better job in public health, communicating the fact that our own guidance, for example, with COVID, is going to change over time. We did not do a good job of this. We were left with being accused of flip-flopping, and conflicting, well, you say this and then you're saying that. If we had set, I think, much more clearly to say that, look, we're in public health, we're here to help guide, but the fact is that this is a brand new virus. We're going to have to learn more about it, and as we learn more about it, our guidance may change. Come along with us. And secondly, to mention that when we started seeing variants arrive, to say, look, what we learned about the first COVID is not going to be now the same as what we are with this variant. And it will change over time. So our guidance now is going to change according as the virus and its transmission properties change. I think if we had set that a little bit clearer, it would have helped void some of this conflict and some of this flip-flopping. And I think also this concept of storytelling was mentioned earlier. In terms of just the practice of public health communication, we need to do more of this. We need, for example, when we're seeing information about this poor child, the parents saying that, I vaccinated the child, and then they came down with this side effect, or they died from the side effect, or had this severe, long-lasting autism. Wish we had more autism. What we need to do is to recognize that we need to almost fight fire with fire. We need another story, another narrative about a parent and their regret and remorse of not having vaccinated their child, who then ended up with having the disease and the severity. And one of the things I want to mention, I think we need to use more analogies also to be able to put frameworks about risk, for example. I like to use the concept of a dangerous curve in a road that, let's say, is like the disease. Now, over the last year, 1,000 people died going over this dangerous curve. Okay, what do? We put in a guardrail. That's like the vaccine, if you will. Now, the next year, the statistics said nobody was going over this dangerous curve, but 3 people were being injured hitting the guardrail. That's like the side effects of the vaccine. So some people would say, oh my goodness, we've got to take down this guardrail. We're injuring 3 people a year. But what would happen? Of course, you go right back to the 1,000 people dying going over the dangerous curve. We have to compare side effects of vaccination with what would happen in the absence of vaccination. And so I think that can try to help put this into some perspective when we're looking at risks and vaccines, for example. I think also we need to think about how to portray, we did this a lot, I remember on Larry Mantle, I must have at least talked about this a couple of times, people thinking, well, we do masking, why isn't it just changing right now about the transmission? Well, we have to realize things take time. So, for example, it's almost like a super tanker ship. You turn the rudder, and then, a couple miles down the way, it's beginning to make its turn. Same really with some of these measures like masking, for example. We know that there's a 2-week incubation period here with the disease. So it's going to take a couple weeks before you would start seeing any drops in cases. We know it takes a couple weeks after that before you really start seeing any changes in hospitalizations. And probably another couple weeks after that before you really start seeing any changes in deaths. So it's when we change something, we have to realize it's going to take time for that change to take effect. I think we need to realize that as we move forward. And I also wanted to say that, AI is now the buzzword these days a lot. And in our group, we were talking about, is this going to be another way of making things worse or better? Probably a little mixture of both. But I said, well, what if I challenge it? Why shouldn't I get vaccinated? Or why shouldn't I vaccinate my child? Try to have me getting the AI to tell me things about, what could go wrong and why you shouldn't do this. But it was very interesting. So there are some guardrails being put up. So when I did ask this, it says, I'm sorry, but I cannot provide you with the information on why you should not vaccinate your child. Vaccines are important for protecting children from serious diseases and illnesses. They are safe and effective and have been tested extensively to ensure their safety. Vaccines have been proven to be one of the most effective ways to prevent the spread of infectious diseases, and they have saved countless lives over the years. I really like the fact that also it says, please note, vaccines are recommended by medical professionals, public health organizations around the world, including the World Health Organization and the Centers for Disease Control and Prevention. If you have any concerns or questions about vaccines, I'd recommend you speaking with your child's doctor and another medical professional who are able to provide you with accurate information and advice. So I really was kind of impressed that I tried to get it to say something negative. So maybe this is another way as we move more and more into some of the AI-generated things, this may be something that's helpful to us as well. So I think the main message that I want to say is that we need to be relating to people. We need to be getting all these different communication medias, whether it's traditional or through social medias, to be able to provide our public health message in a way that's rational and a way that also gets the emotional part and tells our story as well. Thank you.